The ReCircuit study is a very important study because it's a multi-center, international, randomized controlled trial comparing Dabigatran Etexilate and dose-adjusted Warfarin in patients undergoing an ablation procedure. Previously, doctors have felt that they had to change to a vitamin K antagonist or use bridging techniques or perhaps dropping doses of a NOAC therapy prior to ablation procedures because they're worried about bleeding adverse events. This trial was set up to compare dose-adjusted Warfarin and Dabigatran absolutely uninterrupted, so no tablets were dropped. Now the results were very interesting. Some 318 patients or thereabouts in both groups were treated, one with Warfarin, one with Dabigatran Etexilate in full dosage, 150 milligrams twice daily. They were followed during the procedure and for 8 weeks after the procedure to look specifically as a primary endpoint for major bleeding events defined using ISTH criteria. The results were, to my mind, very interesting because there were 22 bleeding events in the Warfarin group and there were only 5 with Dabigatran Etexilate. Now this was statistically significant. The hazard ratio was 0.22. There was a 5-point-something% absolute risk reduction, which was, I think, completely unexpected that the results would be as good as this. Now this trial has some implications. It will stop cardiologists feeling insecure about using a NOAC drug. It will mean that they don't have to swap to a vitamin K antagonist with all the hazard that encompasses if you do that. It means that Dabigatran Etexilate can be used very safely, continuously, and therefore patients are not exposed to the risk of stroke by stopping the drug or reducing the dose. It also has, I think, a much broader connotation that relatively low-risk procedures can be done safely on a NOAC treatment rather than having to bridge or having to swap to a vitamin K antagonist. So these results are important to the electrophysiology community in particular, but to cardiologists and other physicians across the board.